Good afternoon, everybody. Thank you for being patient as we work out some technical difficulties that I'm sure everybody has been experiencing in one way or another with your families and trying to do remote schooling and just kind of the new way of the world. I want to introduce myself quickly. My name is Joey Hanna. Some of you know me. I'm the Executive Director here at the Utah Parent Center. And we are excited that so many of you have decided to join us for today's Zoom meeting with DSPD. And just a little bit of business for DSPD has prepared a presentation, a brief presentation that we think will answer a lot of your questions. This particular webinar is geared for families who have a loved one who is already receiving services through DSPD. I do think in reviewing the slides, I do think that there is probably some information that's pertinent to other families that are receiving services on other home and community-based service waivers. But specifically, this is the Division of Services for People with Disabilities providing this presentation today. Like I said, the division has prepared a slide deck and some information that I think will get to a lot of questions. If you have questions that are not answered during the slide, we'll have a question and answer session at the end. So we have Tyler Black, who is on the leadership team at the Division of Services for People with Disabilities, and also Jamie Withrich, who's the Associate Director, on the call now, and we expect Angie to join within the next 10 minutes. So without further ado, you should be able to see Tyler's a projection of his slide presentation on your screen now. And I'd like to turn the time over to Tyler to start with the slide presentation.
Great, thanks, Joey. So my name is Tyler Black. I'm here representing the Division of Services for People with Disabilities, and we have just a few slides to go through, and like Joey mentioned, then at the end we'll try and spend the bulk of the time today going through your questions, either through the chat and we'll work together to answer those questions. So we have a few slides here prepared, and this just goes over some of the changes to our system that are happening very rapidly in response to the COVID-19 crisis. And a lot of these are built around some funding that we're in the process of working with the governor's office and the legislature to issue really quickly. And a lot of that funding was authorized in mid-March, I think March 18th, as part of the Families First Coronavirus Response Act. So if you've noticed in the news, there were a couple rounds of stimulus packages that were passed. This was the first one, and what it did was it gave an increase to our federal match rate that we receive for our Medicaid services. So like Joey mentioned, the material we're going to be going through today is specific to Medicaid clients who are currently receiving DSPD services through one of our Medicaid waivers, whether it's the Community Supports Waiver for people with intellectual disabilities and related conditions, the Acquired Brain Injury Waiver, or the Physical Disabilities Waiver. This material would apply to those people receiving those services. So to start with, we just wanted to make sure everybody's aware that we recognize what a challenging time this is. We understand that your family members, your loved ones are having to go through this difficult time, and so we are making some changes, like I mentioned, very quickly to change our practice and to support people, to support their families. And so the changes that we're making, that we've put in place, are there to support people and to help people living in their homes, especially as they're spending extended periods of time at home. So the first item that we're looking to implement is a retainer payment. And a retainer payment, what that does is that allows staff who are unable to work because a lot of day programs are being closed due to the guidance from the governor on limiting the number of individuals in a group setting. So larger day programs are being closed, and the impact to those day program providers, we want to make sure we keep a healthy provider infrastructure in place through this crisis. So the retainer payments allow us, and this is authorized by Medicaid, to make payments to the provider so that they can keep staff on retainer during this period. And that went into effect in mid-March. The next one that will be probably of high interest to a lot of people on this call is caregiver compensation. So some of you may have been following the most recent legislative session, where a study was requested and completed last summer prior to the session that was exploring the possibility of adding caregiver compensation to our waivers. So in other states, their waivers in other states offer the capability of paying parents, spouses, guardians, other legally responsible caregivers to provide the direct care to people in services. And so in response to this COVID-19 crisis, we've requested authorization from the federal government to temporarily allow these legally responsible caregivers to be hired as direct support professionals and provide care to the person while they're staying at home, and especially if staff are not able to come into the home because they're being quarantined, or because of social distancing precautions. So this is the limitation on this is 40 hours per week per individual, and we are issuing some guidance to support coordinators and families tomorrow, and that guidance will walk through the details of how do I get myself set up as an employee and what paperwork is required. In general, what's needed is approval by the support coordinator. So for families that are interested in pursuing this, the first step is going to be initiating a request with the support coordinator to get the family member set up as a direct support professional. And the guidance will be going out tomorrow. So when you see that guidance released, it should be on our website. And if this is something that would apply to you, please contact your support coordinator and they can walk you through the process of how to get set up. Okay, the next item that we're implementing in response to COVID-19 is a rate increase. And the rate increase is across the board any service that includes a direct care staff component. So over the past several years, maybe the last 5 years or so, we've had appropriations from the legislature to increase service rates for those services that have a direct care staff component. And a lot of those services, if you're using the self-administered services or the SAS model, you've probably seen those rates go up a little bit every year over the last 5 or so years. So those same services that have been receiving those increases each year will be subject to a rate increase. And the purpose of that rate increase is to help with recognition pay. So for those frontline staff who are continuing to work during the crisis, going into people's homes and going out into the community, we are increasing the rate that's going to be paid to those staff temporarily during this period, for this 3-month period beginning 4/1. this, for those who aren't using the self-administered model, the rate increase will be applied to the traditional provider-based model services as well, and those funds will also be available to help alleviate some financial pressure to the providers that they're experiencing as it relates to overtime pay and purchase of additional equipment and sanitary supplies. The next item has to do with school closures. So this is something you'll notice some of the implementation dates that I mentioned of April 1st. This is something that has went into effect beginning in mid-March when the schools issued a closure. And so as a result of that, a lot of people who are needing to stay home, we've had to increase how many hours the person is getting, because if they're normally spending that time at school, they're needing additional support at home. So we're doing everything we can to help families during this time, and that means increasing the hours of support that the person needs since they no longer have the public school system available to them. Those budget adjustments are currently being done. Again, if that's something that you need as a family member added to your DSPD budget, the first step would be to notify your support coordinator, and they have a form that they're submitting directly to our finance director to request that increase to the budget. And those approvals are turning around really quickly. So if that's something that you need, please notify your support coordinator about that. Okay, the next one has to do with supplies related to COVID-19. So obviously, I'm sure you've heard in the news, there's a big shortage of personal protective equipment. We're being very mindful of the fact that these supplies are needed in the hospitals as well, and we're in the process of trying to procure some of these supplies, and you know, recognizing that there's a shortage, there may be a few weeks delay before we're able to secure those items, but we're working hard to get those.
Most of you probably do not know what an Appendix K is. So for people who are receiving services, they receive them through the waiver, a Medicaid waiver. And the Appendix K is something that is added on to our waivers that allow us to do, to modify our services during a crisis, whether it's a natural disaster or a pandemic like we're experiencing right now. So as we've worked with the Department of Health to put things into the Appendix K, we included things that we heard just anecdotally from parents and others contacting us. And formally, we made sure that the Department of Health included a family to review what was being submitted so that we could make sure that we're representing the needs of families and that we have the right supports around you. Some things that are in the plan that will affect you guys are, typically you have a person-centered planning meeting annually. It's still an option to have that meeting if it makes sense and everyone's able to do it. But what is being allowed is that plan does not have to be renewed for an entire year if it happens during the period of this pandemic. Also, the support coordinator will still activate the plan to make sure everyone can get paid, and they'll still be able to make any changes they need. So let's say that your family member has been in day services and they moved to all residential supports, or they're now at home. It makes it, the support coordinator is still going to be able to move their funds to where their support is happening and where they need the support. Some of what is also added is the ability to provide social and emotional support for people who are experiencing maybe additional isolation or just a limit in their social activities and their typical routines. This isn't something that is typically part of our services, but it's been included. And it also allows for things like errands, grocery shopping, other activities to be done without the person present. Typically, services are billed when you're directly supporting someone, but we want to make sure that people are safe and protected, and we want to minimize their exposure while making sure they have the right supports, they have the things they need. And there also has been an expansion of the number of overnight respite days that can be done in a row. So those are some of the things that could directly impact how you guys are receiving and using your services. I believe that is our last slide, but we'll have it open for questions. Unless
Okay.
Tyler, you wanted to add anything.
No, I don't have anything to add. I'm just looking at the chat to see what the questions are.
Okay.
We have one question for sure, Angie, and the question is, does the caregiver compensation apply to the medically complex children's waiver as far as you know?
So the Appendix K, as far as I know, so the Appendix K, it covers all waivers, but each waiver has its individual items in it. And since the medically complex children's waiver is not under DSPD, we weren't involved in developing that. So I can't speak to what's in there for that waiver.
Do you know how a family member who has a person on that particular waiver would be able to find that information out?
I'm trying to think. I'm trying to think if the Appendix K is public. Because it's been presented in an emergency, there wasn't that typical time for public comment where people would be able to review it. So I don't know that, but I can send a text and see if I can find out.
We can certainly also, the Parent Center is happy to try to find that information out too. Well, let's move on to another question. Do you know if Appendix K has been submitted and approved yet?
It was submitted, but we haven't, it was just submitted last night, and so we have not heard back yet. The turnaround time has been pretty quick for states, but not quite, less than 24 hours.
Okay, awesome, thank you. Okay, another question. Does caregiver compensation come out of our regular budget, or is it additional money added to the budget?
It's going to depend on your budget and what those needs are. So if day supports are moving, if that funding is new for support in the home, then it would be moving budget money within your budget. If someone has been in a service that wasn't funded and now they're home, it could be additional funding. So it's going to depend on what those services look like for people right now.
Okay, awesome. And I know this particular meeting is specifically focused on people in services, but there is a question about how will people on the wait list be affected by COVID or any of these changes? And I don't know if you have any comment on that, Angie.
So as far as our processes go, as far as waitlist goes, like we'll keep following things as we have. It might, so if someone were to get funding, it could take longer to get someone services simply because there's a lot more caution around like providers meeting other people, introducing someone new into a setting. They're trying to just be a lot more cautious about minimizing exposure to everyone else they're supporting as well.
Awesome. And then there's a question, and this is kind of more business related, but there's a question about whether or not the participants in this group will have a complete summary of the items that you talked about and access to this recording. So in terms of access to the recording, yes, the Parent Center will post this this recording on our COVID website, which you can access just from the regular Parent Center website. And then Angie and Tyler, I know that DSPD, I've been on your guys' website and noticed that you have quite a few resources on there. So is this the information that you presented also available there?
So the slides we can definitely make available there. And then we do have like the letters that we've sent to families available there. When we send one out with more details around kind of how to get your caregiver compensation set up, we'll have that included there, so that both support coordinators and families and providers, they'd all have access to that same information.
Okay, excellent. And then we had a question about the PPE or the sanitary supplies. A family member wants to know if they purchase them and then get reimbursed by you, or do they get them from you? So yeah, that's the question about that.
So the personal protective equipment is definitely a big question, and it's something that we're trying to help find solutions to. We have sought to purchase, but we're like the date that we'll receive some like masks and gloves is out in the future a little bit, but we've done it with the intention, because we've heard from parents that either a provider won't come into their home unless they provide the personal protective equipment, or they're just not comfortable having someone in their home without that protection for their family. And we know there's a challenge, so Tyler has been working on getting masks and gloves, and we're still working towards other things. So if you have a source and you're able to get it, definitely pursue getting personal protective equipment, some of the things you need. And there will be a means for reimbursing for, and then when we are able to get something, we'll be reaching out to support coordinators on who needs it, how do we get it to them in a way that is safe and doesn't compromise people.
Okay, so the short answer to that question then in summary is just that, no, it's just that families will be able to access it from you when you get it, and the way that they would do that would be through their support coordinator.
Yes.
Okay, well, thank you for trying to get your hands on that for families. Okay, the next question is, so in regard to additional hours due to school closures in people's budgets, does everybody just get a standard amount, or is that something that people need to work with on an individual needs basis through their support coordinators?
That'll be individual as well, because the support needs of each person is going to be different. What else, right? The other supports that they have, other things that they might have going on, are going to vary. So it's going to be individualized as well.
Okay, and then another question, in terms of person-centered support plan reviews scheduled for after the emergency ends, will those happen at the normal scheduled time?
Yeah, so the exception lasts for the duration of the pandemic. And then after that, we'll be back into the normal routine. So we won't, like caregiver compensation lasts the duration of the pandemic. The exceptions to person-centered planning is just during this period of critical need. So.
All right, fantastic. Okay, we have a few more questions. Is there retainer payment for SAS staff as well?
So that, so some of those things are what we're kind of figuring out, when a retainer payment would apply, or when the other measures in the Family First Coronavirus Recovery Act, because there are some things around unemployment and compensation, and we've also looked at retainer payments for SAS when that may be needed. So.
Okay, excellent. Can we use the parent reimbursement and also still utilize staff for chores or et cetera? Not at the same time, obviously.
Right, so it would just be the same, making sure that the services are meeting the needs of the person receiving the services, and that they are not billed at the same time.
Okay,
So
then, oh, sorry, go ahead.
it'll just be getting that right mix of services, kind of the way you do it today, just with an additional option.
All right, and so can families hire new staff even if they cannot get their fingerprints due to the issues around COVID?
So the Office of Licensing has worked it out that people can do a name-based background check because of that very issue. Everyone is facing that issue.
Okay, excellent. And then does the division plan to pull any new people off the waiting list this year after the legislative session, or will that be affected by COVID?
So I think that is a reasonable question. During the session, funding was allocated. Will what might happen later as they're evaluating the resources in our state due to the effects of COVID? I'm not sure, but any allocation we have, we will be using. So if we have allocations to bring people into services, that's what we'll do. It could just affect the pace or when people come into service.
All right. I don't know if you have any indication on this, Angie, but do you have any idea what the turnaround time is for the alternative background checks?
I don't have that information offhand, but we could. Are you keeping questions I don't have answers to, and we can follow up on them?
Yeah, absolutely. Yeah.
Okay.
I'll help follow up, and then the Parent Center, we can either do another meeting, or we can explore ways that we can get that information out to people.
Okay, thanks.
And then another question, what is the increase in pay for SAS people still working?
So the request in the Appendix K for all services is for all direct care services is a 13.3% increase.
Okay. Thank you. Will only the fiscal agent be used for parent compensations, or will families need to make a choice?
So we were setting it up through fiscal intermediaries, and part of what we're trying to work through with them is how to make it as simple as possible to get signed up.
Awesome. All right. Well, it looks like we've already come to the end of our questions, unless anybody else has any questions. This has been really helpful, Angie, and I would like to thank your staff and all of the people at DHS and the Department of Health for working hard to look out for our families in these times. It's a super difficult time for everyone. So we do have another question, if you have time, Angie, a couple more, if you have a minute. Okay, what are options for day services for a child in a program that's closed down?
There are definitely limited options for day supports right now. We have programs that have closed, and because the reason is they're really looking at how to mitigate and minimize risk and exposure for people that they serve and care about as well. We do have some providers who are still doing day supports following the CDC guidelines, groups of 10 or smaller, and that's counting staff, right? When you get, it's groups of 10 or smaller, maintaining social distancing. So there are some day supports still out there. Some people are able to have day supports provided in their home. It kind of just depends on the type of support that they're getting, if that makes sense, or if supported living makes more sense. So that's the type of option out there, but like the day supports are limited for sure right now.
Okay, thank you. Okay, there's a question from a support coordinator asking if you anticipate all the clarified details for the SCEs to be available to them tomorrow.
That is what we're planning on, yep.
Awesome.
So all parents, don't call your support coordinators today. They won't be ready.
Okay.
We won't have information to them until tomorrow.
Okay, fantastic. Another question, what are services staff can provide for clients virtually?
So supported employment, supported living. You probably all know that all support coordination is happening via telehealth right now. Day supports, and there's a fourth one. I don't know why I'm drawing a blank. So we have a question to help you all with this. We have a question and answer on the DHS website. So if you go to dhs.utah.gov, there's a Q&A for all of our department. There's stuff that's specific to DSPD in there. It does identify the services that can be provided with supported living or with telehealth. I do want to be clear, even though something can be provided through telehealth, it doesn't mean it's the right way to do that service. So if someone has supported living, but their needs cannot be met through telehealth, then telehealth, even though supported living is one of the codes that can occur via telehealth, if the need cannot be met, then telehealth is not an option for that. Was that too jumbled?
I mean, it's a little bit complicated, but I think generally speaking, it makes sense. In other words, people shouldn't be, if the service can't be provided, they shouldn't be billing for it under telehealth and saying it was provided. Right.
So, this is an example that I'll use because it's come up a couple of times. So someone will say, can we support someone to develop their menu via telehealth? That makes sense. That's something you can do with someone, right? And you don't have to be in the same room as them. But they really need to be understanding what that person's needs are. Are they able, I mean, getting what you need at the grocery store has been different for everyone, which means for people we serve as well. So if you help someone create a menu, but they're not going to be able to get to the store, or they get to the store and they won't be able to buy the things they need. So people really need to be assessing what is the support need the person has right now under these circumstances. So maybe previously they didn't need that type of support to get to the store and do their shopping, but today they might, just because things have changed. So that's what I mean. So telehealth, because something is eligible for telehealth, does not mean that is how it will be provided. It has to be provided in a way that meets that person's needs.
That makes sense. Thank you. Okay. What do you have a sense of what day supports are still functioning?
Meaning the providers that are still open?
Yeah, I guess that's a little bit difficult question because it could be different county to county.
And I also think it doesn't, even if someone is operating, I don't know that they are serving additional people either. So that could be a tough question.
I see. So if a parent has a kid or a loved one that's been utilizing a service that is closed, they may not be able to shift and find one that's open.
Right. I would encourage them to work with their support coordinators. I mean, we can still send out requests for those services and see if someone responds, see if they're available in your area. I do think there will just be a lot of limitations right now.
Okay. We have had a couple more questions from people that have joined late that asked if this recording would be available, and the answer is yes. We will make the recording available on our website at the utahparentcenter.org, and we'll also, I think we have the capacity since you all registered to email a link of it out to you, which we can do also. Okay, Angie, thank you. There's another question about what do social and emotional supports look like? And I'm not sure I understand that question, but maybe you do.
So typically you're getting paid to do something like skill building, you're providing a specific service, but part of what people might need support with right now is more of that coping with a new circumstance, adjusting and adapting. So that's kind of where the social and emotional support comes in. So we're not saying what's the task you were working on, but it's acknowledging that part of it is just that emotional support, or could be.
All right, thank you so much, Angie. This has been super helpful. So I think that's about all of the questions that I've seen. If I've missed any, there's another one. If an emergency situation comes up for someone that is on the waiting list, such as hospitalization, loss of income, death, is there emergency funding available for waitlist people?
So all of our funding is currently directly serving people. Anytime we have funding come available, we do identify right where that most critical need is, but currently we don't have funding for new people coming into services.
Thank you. All right, I'll give just a minute, Angie, if you don't mind. I know we had you scheduled till about 2:30, so we're going to take every minute of your time that we possibly can. But again, we really do appreciate you being on here. So just looking to see if anybody else types any questions. There's a question that says an earlier slide showed changes effective as of 4/1, but if the directions won't come out until tomorrow, what elements would be affected since the beginning of April?
I think that's a good question, and we debated about how to best present that slide. So one of the things what went into effect on April 1st is we had an emergency rule change. So prior to April 1st, the existing rules in our state would have prevented us from being able to pay a parent or a guardian or a spouse. So April 1st, we got that in place so that we'd be able to pay caregivers. And then following that, right, as soon as people get signed up. So that's why we want to get the information out to families and support coordinators as quickly as we can.
Okay, awesome. Okay, we have another question, and this one's from a parent center parent who has a child in services at DSPD. So is it possible if the parent knows someone from one of the day programs that their child attends, that their child is already familiar with and has a relationship with, can the parent set up home care and have the billing still go through the program that they work for, rather than hiring them as a SaaS provider?
So I would work with the provider on that. I do think providers are really looking at options too of how to meet people's needs when they move, when they're not providing supports in a day support location anymore. So I do know that there are circumstances where some people are getting day supports in the home. So make sure you're working with the provider on that if that's something that they're doing.
Okay, and then two more questions about caregiver compensation, which is obviously a hot topic. Will the pay for caregivers be retroactive to April 1st?
So that is going to come down to like federal laws. I'm not the expert on that. I'm pretty sure you have to have an I-9 in place to get paid. So, but I work with the fiscal agents. But my anticipation is it's the date that you get that.
Okay.
In.
And then will the caregiver compensation cease after 6/30/2020?
So right now, our fiscal year ends in June, and we've anticipated what these costs would look like through June. But the caregiver compensation will end as like if our state determines that the pandemic is over, then it's going to end at that point, because the caregiver compensation is part of our response to COVID-19, being flexible, trying to make sure people have the right supports. So once that's no longer declared, then services will be restored to how they were.
Okay. There's a question from a provider, and I know you have some weekly regular provider meetings, but
Right.
if you're okay to answer a provider question, I think it's appropriate for families too, so I'm happy to ask it. Might funded virtual day supports become available for day programs?
So one is that question about, so right now, one of the services that we've identified for telehealth, so I'm assuming that when you talk virtual, we're talking about telehealth. It's still a direct face-to-face service. So day supports does have that option. It cannot be billed at the same time as any other service. So if someone is getting supported living, they're not going to be getting day supports at that same time. So it's still, those same rules still apply. It's finding the right services to meet that person's needs. And the day services still need to fit within that code and make sense for that person. So, but we do have an exception, right? That's part of the allowance that we're requesting in the Appendix K is day supports could be offered through telehealth when it makes sense, and that they can be in a home setting rather than outside of the home.
Awesome. Okay. And then a couple of other questions. What if the caregiver, the SAS, is also the SAS administrator? Can they get paid?
They can, and that is definitely not typically the case.
Right.
It is an exception that so this is, I guess I should say that is the proposal. What we've requested with the Appendix K is that even though there is that conflict of interest, that during this time that is waived or there's an exception made for it.
Okay. There's a question about, will the retainer payment for SAS employees affect their unemployment, and would it disqualify for them from unemployment? And I can answer that if you don't know the answer to that.
I don't know the answer, and I'm impressed if you do.
Well, I think it's just a general unemployment question, and any income does have to be counted as part of an unemployment claim. But I don't believe that a SAS that it would disqualify a person from unemployment just across the board. It will go into it would have to be counted as income. So that's kind of the main answer to that question. All right. Well, that was a lot of questions. They kind of came flying in there, and I really appreciate your time and everybody else's time for being willing to hop onto this call. I'm sorry if any of you had to come in and come out. We had a little bit of a hard, we thought we had 300 maximum participants on this Zoom account, but it turns out we only had 100. So there were quite a few people knocking at the door to get into this meeting, Angie, so you're popular. So again, the Parent Center will post this meeting. We'll quickly get this turned over so that we can post it on our website. And we will maybe reach out to you, Angie, and see if we can do another one of these calls. It's been really super helpful. I'm sure it's been super helpful for families. I know it has been for me. So, and also I do want to say, if you have any specific questions about your people and any questions that the Parent Center might be able to help you with, we are still operating, we're still open. We're just not in our physical location. So don't stop by to visit us because we're not there, but we're answering calls and we're working with parents individually, just like we do every day. So feel free to give a call to us. And I don't know if you have any closing remarks, Angie.
So I just want to say thank you so much for the time. And I did want to say thank you to parents who, like, I understand that some parents have been making masks for some of our providers, which is super impressive. I just want to say thank you for your thoughtfulness, because, right, it's something that everyone's having a hard time accessing. You have families and priorities to take care of, and the fact that you are helping others is very generous. So I wanted to say thank you for that, and really just thank you for your time.
All right, everyone. Well, I hope you all have a great rest of this Thursday afternoon. And thank you again so much for all your time, and thank you to Angie, and thank your team for all of the hard work that they've been putting into being responsive to this